Coronavirus could travel 27 feet, stay in air for hours, MIT researcher. Social distancing guidelines to stay 6 feet from others may be woefully inadequate, one scientist warns, saying the coronavirus can travel 27 feet and linger for hours. MIT Associate Professor Lydia Bourouiba, who has researched the dynamics of coughs and sneezes for years, warns in newly published research that the current guidelines are based on outdated models from the 1930s. Rather than the assumed safety of 6 feet, Bourouiba warns that pathogen-bearing droplets of all sizes can travel 23 to 27 feet. Her research, published in the Journal of the American Medical Association, also warns that droplets that settle along the trajectory can contaminate surfaces, and residues or droplet nuclei may stay suspended in the air for hours. She notes a 2020 report from China that showed that virus particles could be found in the ventilation systems in hospital rooms of patients with COVID-19. Bourouiba fears that the current guidelines are overly simplified and may limit the effectiveness of the proposed interventions against the deadly pandemic. She says it is particularly urgent for health care workers who, she argues in her report, face an underappreciated potential exposure range while treating the sick and dying. There's an urgency in revising the guidelines currently being given by the World Health Organization and the Centers for Disease Control and Prevention on the needs for protective equipment, particularly for the frontline healthcare workers, Bourouiba told USA Today. The World Health Organization, which suggests 3 feet is enough to remain safe, told USA Today it welcomed studies. WHO carefully monitors emerging evidence about this critical topic and will update this scientific brief as more information becomes available, WHO said in a statement to the paper. His travel history reveals that he had been everywhere before confirmed positive for coronavirus in Srinagar. He had been to Delhi, Deoband Seminary, Jammu and then to a Sapor mosque in North Kashmir. And finally, this 65-year-old man started showing symptoms of COVID-19 and had to be admitted to a hospital. The doctors tell Outlook that 2 more people tested positive for the deadly virus on Tuesday in Srinagar, taking the total to 4 in the valley. The 65-year-old man is patient number 2. He has been to almost all the places. While another 57-year-old, patient number 3, lied to doctors about his travel history and has endangered his life, says a doctor. The STAR novel coronavirus policy will provide a lump sum payment to the insured person who has been declared positive by a government-accredited test and has been hospitalized. The policy is available only to individuals between the ages of 18 years and 65 years. Anand Roy, managing director, STAR Health and Allied Insurance said, the STAR novel coronavirus policy has been designed to cover those who test positive whether or not they have traveled beyond the country's borders. The coronavirus cover will help provide a lump sum payout for those affected to meet their hospitalization expenses. According to the policy wordings, the STAR novel coronavirus insurance policy is available under 2 sum insured options of 21,000 rupees and 42,000 rupees at premiums of 459 rupees plus GST and 918 rupees plus GST respectively. Anyone up to the age of 65 years can purchase the policy online by visiting the Star Health website or through the company's vast network of insurance agents, and without having to undergo any pre-medical screening. Added to this and more importantly, the policy does not have any international travel-related exclusions. Roy also said that all of Star Health's regular health insurance plans cover treatment for COVID-19.